on prenatal health, labor, and delivery. Dr. Mary Norton is a professor at Stanford School of Medicine and director of prenatal research at Packard Children's Hospital. A graduate of University of Washington School of Medicine, Dr. Norton served her residency at Tufts University School of Medicine, as well as a fellowship at University of California, San Francisco. She's board certified in obstetrics and gynecology and in maternal fetal medicine by the American Board of Obstetrics and Gynecology, as well as board certified in clinical genetics by the American Board of Medical Genetics. I've had an opportunity to say a mouthful today. Dr. Norton has published a variety of research papers related to prenatal diagnostics as well as high-risk obstetrics. Let's give Dr. Norton a warm welcome. Thank you so much.
Thank you very much. All right, and I'm actually going to talk about prenatal genetic screening and screening for birth defects in pregnancy, because that is a big part of what happens during a normal pregnancy, and I think often people don't hear much about it before their pregnancy. So hopefully some of you that will be of help. And generally with advances in genetics now, some kind of prenatal genetic testing is offered to everyone during their pregnancy, and that includes testing for things like common birth defects like spina bifida or heart defects in the baby, chromosome problems like Down syndrome that people have often heard of, and then genetic diseases like sickle cell anemia and cystic fibrosis and things like that. And testing for some or all of these is offered to pretty much everybody during a normal pregnancy. And the first genetic screening test that was kind of out there and that people are familiar with is just how old are you? You know, and the reason people are asked that is the chance of having a baby with certain kinds of birth defects, but certainly not every kind of birth defect, goes up as the age of the mother increases. So common chromosome problems like Down syndrome and some other things you can see on this chart, as the mother gets older and older, the chance of having a baby with these problems increases, although there's never an age at which it's 0, and there's certainly never an age at which it's 100%. So it's always a risk that goes up, but it's the kind of thing that can occur in any pregnancy. And when women are over 35 and they are thinking about pregnancy or they get pregnant, they'll often see a genetic counselor to review those kinds of risks and talk about what kind of tests are available. And we have these charts that we go through with people to say, at your age, this is the chance of having a baby with Down syndrome or a different kind of a chromosome problem. So being over 35 when you get pregnant has gotten a lot of bad hype. But really most women 35 and over have perfectly normal healthy babies and normal healthy pregnancies. But 35 has been traditionally kind of the standard age at which women get offered something called amniocentesis to check for chromosome problems and that kind of birth defect in the baby. And the reason that age was chosen, it's not that something happens on your 35th birthday, it's that as this risk goes up, when you get to be 35, the chance of having a complication from a test like an amniocentesis is about the same as the chance of finding a problem in the baby. So those two things are equal at that age, and that's why that age was chosen as when we would start to offer people testing. But one of the important things that we've realized recently is that for the women who are being given this information, often the risk of having a baby with Down syndrome and the chance of having a miscarriage are really different things. And for some people, they might be much more worried about one thing than the other. So we're kind of moved away from making such a big deal about age 35, and now more commonly we just talk to all patients about all their risks and kind of work with them to figure out what kind of tests they might want. And certainly we're much more supportive than we used to be of women just saying, I don't want any of those kinds of tests. That's not something that is important to me to have during my pregnancy. And that is a completely acceptable approach to take. So as I said, you know, this picking this age in this, which is somewhat arbitrary, is something that was really done a long time ago. And now, although we do say, you know, you're over 35 and may refer people to discuss amnio, it's much less of a kind of black and white way that we counsel patients. So prenatal genetic tests that we do, there's different kinds of tests, and some of them are blood tests on the mother, and sometimes those are best done before pregnancy, and sometimes those can only be done once you're already pregnant. Ultrasound to look at the baby, and obviously that's something that you would do during a pregnancy. And then amniocentesis and something called chorionis villus sampling, or CVS, which is very similar to an amnio, and I'll just talk a little bit about what those things are too. So the kinds of tests, in addition to some are blood tests and some are ultrasounds, it's an important distinction that's often confusing to people, that some of these are so-called screening tests and some of them are diagnostic tests. And the screening tests are done to figure out if you are high risk for having a baby with a problem. So in general, these tests don't tell you for sure that there's a problem. They just might indicate that you may want to have additional testing done. And usually the benefit of screening tests, although they're not so definitive, is that there's not a risk to those tests. They just tell you you're high risk or you're low risk, but there's not a miscarriage risk associated with those, as opposed to diagnostic tests like an amniocentesis that is done by actually taking fluid from around the baby using a needle, and because of that procedure, there is a chance of miscarriage. So the information you get is very definitive, but there's a risk that goes along with that. So as I said, everyone gets offered some kind of testing during their pregnancy, and women get offered blood tests for different kinds of inherited disorders, and often that varies depending on your background. So people from different parts of the world are at risk for carrying different genetic diseases, and what tests they get offered may vary depending on that. And often people will have something in their family history that is a sign that they could be a carrier of a genetic disorder. And really, one thing I think is really important to think about is if you do have something in your family or something that you are worried about, it's far better to see a geneticist or a genetic counselor before you get pregnant and sort of figure out what kind of tests might be done and what is the best approach before you've already conceived a pregnancy. And I'll talk a little bit more about why that is. Once you are pregnant, everybody gets offered testing for chromosome problems like Down syndrome, as I said. And pretty much in this day and age, everybody gets offered at least one ultrasound during their pregnancy to look for all different kinds of things, but one of those things is birth defects and to make sure the baby's developing normally. So family history I mentioned, and what sorts of things might be in your family history that you'd be worried about? You know, everybody has great Uncle Fred that is crazy and they wonder, does this mean I'm at risk of having a baby with the same kind of problems? And as a general rule, we really only worry about our closest relatives. So if you have a brother or a sister, or you've had a previous child with a problem, or one of your parents has a problem, that may put you at risk for carrying a genetic disorder, but cousins, aunts, uncles, more distant relatives usually don't present a significant risk that you will have a baby with that same problem. So that is kind of reassuring to know. It has to be someone that's a pretty close relative. And again, as I said, really always much better to find out about those things before you get pregnant. And this is kind of an interest. This is a family history that is quite famous. This is Queen Victoria, and I don't know how many of you are familiar with the royal family history, but she was a carrier of something called hemophilia, a bleeding disorder, and she passed that on to her sons, who then had hemophilia, and half of her daughters who were carriers of hemophilia. And that was historically quite important in Russian history and British history, this genetic disease in their family. And there are all kinds of other disorders that are carried on the Y chromosome that specifically affect men and boys in particular. So if you find out that or if you are concerned that you have some kind of a serious genetic disorder in your family, one of the things that is available for high-risk families is something called pre-implantation genetic testing. And this is something that is offered to prospective parents who are known to carry serious genetic disorders for which there's been a test developed. And by doing IVF for those people, you can take embryos and actually take a cell off those early embryos and test it for a variety of genetic disorders and only put back and use the embryos that are healthy. So this is something that's not done commonly, but it's just an example of something that might be an option for someone with a disorder in the family before pregnancy, that obviously once you're already pregnant you would no longer have that as a way of avoiding facing those issues when you do get pregnant. So besides carrier testing for common things depending on your background, again, prenatal screening for chromosome problems once you're pregnant, and then the third thing that is routinely done for everyone who has a pregnancy and delivers a baby is newborn screening. And every baby born in the US is tested for a variety of different, mostly genetic, but there's some other disorders that are tested for by doing a heel stick. So the little baby's heel is held like that, and you poke it and get a little drop of blood that's put on a card and sent to a state lab. And these tests are done, different tests are done in different states. It's run by the state, they all have their own program, but it is done as a routine, and parents can decline such testing. They can say, you know, I don't want this done to my baby. But generally these are disorders that if you find out about it right when the baby's born, you can treat the baby and that baby can have a very healthy life. Whereas if you don't find out about it till the baby's much older, there may have been medical problems that have arisen that you could have avoided. So by putting up a hue and cry, parents can decline this kind of testing, but in the absence of that, every baby goes through some kind of newborn screening. And this is just a list of common diseases in certain groups that are tested for. Patients that are of Jewish background have, in addition to Tay-Sachs disease, there are a couple of other disorders that are more common. Most people now are offered testing for something called cystic fibrosis. And then sickle cell anemia and thalassemia are inherited anemias that are common in certain parts of the world. And it's actually kind of interesting. The reason those are so common is that people that carry those disorders are themselves perfectly healthy, but they are resistant to malaria. And malaria in the equatorial parts of the world is a huge problem. And it is a common cause of pregnancy complications, and it can cause death in infancy and childhood. And people who carry thalassemia or sickle cell anemia are resistant to that. So it's very common in people from equatorial parts of the world. But if both parents are carriers, a child can be born and be quite sick. So ultrasound, as I said, everyone gets offered an ultrasound when they're pregnant nowadays, and ultrasound equipment has become much, much better, and it never fails to amaze me. I do this every day, how much you can see in these cute little fetuses. And people always ask, how does ultrasound work? Can the baby hear it? And I have to say, I'm not a physicist. Maybe you guys here at CISCO know better than I do how it actually works. But I do know the baby can't hear it because we can't hear it, because it is out of the range of human hearing. And is ultrasound safe? There are, there's things in the press about ultrasound causing autism and all kinds of problems, but ultrasound is really very safe. It doesn't use radiation. It's not been shown to cause any kind of problems or birth defects, and lots of people have looked into this. Really, the highest risk is that someone will do an ultrasound that isn't very well trained, and they will think there is a problem when there is not, in fact, a problem. And really, that is the biggest risk that we see with ultrasound. If you get pregnant and have an ultrasound, make sure the person doing it is well trained and knows what they're looking at. And this was an editorial written by a colleague of mine that I had a lot of respect for, who pointed out how many pregnant women he saw that had been needlessly scared by ultrasound results. So, and these are some ultrasound pictures. This is a 6-week embryo, and you can see it looks like just a little teeny lima bean at that point. It's a slightly bigger lima bean that if you really know what you're looking for, you can tell the head end, but it still doesn't look like very much. And then by 12 weeks, it's kind of amazing. You can see the head, the profile, the arms and legs. You can count fingers and toes. It's really kind of incredible that in this very short period of time, how much has happened and developed. And then by the time you get to be 20 weeks, you can really see much more detail of the baby's brain, face, heart. And these are just some cute ultrasound pictures of the heart. You can easily count fingers, you can see kidneys, and you can tell if it's a boy or girl, which is usually mostly what the parents want to hear. 3D ultrasound gives you these very cute pictures. It is not really necessary for medical diagnosis in most cases. It's really something that is used commercially because the patients, it makes sense to them. Those black and white pictures don't look like very much. In the 3D pictures, everyone can see that that is a very, very cute little baby, but medically, it's not often necessary, and it is not easy to get those really cute pictures. And I like to say, if you see these ads and you think these are the typical pictures that you'll get if you go to the mall, then you will believe that these are typical CISCO employees. It just doesn't look exactly like what it looks like in the ads. And MRI, we actually sometimes use in pregnancy when there is a problem to further figure out what is going on, and you can get really beautiful, amazing pictures using MRI. These are MRIs of a developing fetal brain. It's really incredible what you can see. And you know, just thinking about the future of prenatal care. This is a picture of fetal surgery, and you hear on 60 Minutes and on the news about fetal surgery to repair various birth defects. And while that can be helpful in rare situations, I think really far, far more important, that doesn't get nearly as much press, is taking folic acid before you get pregnant to prevent these same kinds of birth defects. So anyone in this audience or anyone you know that's considering a pregnancy should take a multivitamin with folic acid before they get pregnant, starting today when you go home. And then testing for Down syndrome, I mentioned there are specialized ultrasounds looking at fluid at the back of the neck that tends to be increased with a variety of different birth defects like Down syndrome. So that is something that most big centers now will offer to patients. And this is just, even if that looks big, most of those babies turn out to be okay. And this is a very cute son of a friend of mine who we were very worried about, and he is just a perfect little boy. Amniocentesis is a genetic test that's been around for a long time that can take fluid from around the baby and do various tests on it to make sure the baby doesn't have a chromosome problem like Down syndrome. It's done between 4 and 5 months or 15 to 20 weeks of pregnancy. And there is a small risk of miscarriage associated with amnio, which is part of the reason not everybody has one. About 1 person in 300 who has an amniocentesis will go on to have complications and potentially a miscarriage. And again, this number is lower if you go to someone with a lot of experience that really knows what they're doing. So again, this is a good time to ask questions before you let someone put a needle in your pregnant belly. But it's an outpatient, quick, you know, from our perspective, pretty easy procedure. It only takes about a minute to actually do the procedure. And this is just what it looks like on an ultrasound. Probably doesn't look like very much to you guys. This is what it looked like in the olden days. It was very scary back then. I don't even like looking at that picture myself. And this is the result that we get. You get chromosomes, and we can count them and make sure that there's the right number of chromosomes. And we can tell from this also if it is a boy or a girl. There are other more fancy tests available now where you can use colored dyes to label the chromosomes and look at them more carefully. This is another way that we sometimes do that to get quick results. And then there's much more of these things are done with microarrays or chips where you can test for all kinds of genetic diseases. And this is really the future. I think those karyotypes where you see all the chromosomes will be of historical interest in the not too distant future, and everything will be done by chips and by computer within the next couple of years. We're already moving in that direction. And then finally, the brand new thing in genetic testing is getting DNA, the baby's DNA, out of the mother's bloodstream, which is something that now is available within just the last couple of months. And I think there'll be more and more and more of this kind of non-invasive testing and less need for amniocentesis. And again, this is already completely changing that, but I think in the next year or two, this is going to really take off, and this is what many more women will be having done, as opposed to needle in the stomach. And just, you know, to go through sort of the history of genetics from Mendel, and this is his actual garden with the garden peas that everyone learned about in high school. And this is the modern garden at Stanford. I have to say, Stanford and Lucile Packard has the most beautiful gardens I've ever seen. I wish they would come work at my house. And thank you all very much for your time.